Hey, my name's Courtney Pridmore. I'm with Bevel State and I'm doing the med administration video. And there's my ID. Okay. And we are going to start off showing the ventris gluteus site with the patient laying on their left side with the right hip up. And then I will use my left hand and place it on the greater trochanter area, and then put my thumb towards the groin area. My index finger pointing towards the axillary, and I'm feeling for the iliac crest. And then I'll move my other fingers over here and then place an alcohol pad in this area between my two fingers to give the shot in that area of the hip. And then we'll move to the vastus lataris, and the patient will stay in the position with one palm of my hand on the greater trochanter, and then my other hand I will place it on the femoral and then with my thumbs like this, with this hand here, it'll form a triangle area, and that is where, in the center of the triangle area, is where you will give that shot. Okay, and now I'll have the patient sit up. Okay, and then I'm going to look at the, for the intradermal injection, and you'll put a hand here, and then a hand here at the wrist. And then it will make a area to where it'll be in this area, but it'll be the center line is where you can give the intradermal. And then with the patients, to do the deltoid, you feel for the Ackerman process or at the top of the arm, and put the pinky finger on the bone, which is right here. And then you move the index finger down to form a triangle, and then you inject in this triangle area right here. Okay. Okay. So I have my medication orders for my patient. The doctor ordered for Jonah Doe, insulin NPH 10 units, insulin regular 5 units, Rocephin 500 milligrams, and a TB skin test. So we're going to start getting everything ready. So I'm going to hand hygiene. I'm going to make sure my area is clean. I'm going to put my gloves on. And then I'm going to start getting my area ready. So I'm going to get my Rocephin out, my insulin NPH, insulin regular, TB skin test. Going to get my needles, alcohol prep pads, Band-Aids. Okay, so we're going to start with the TB skin test. I'm going to check the date to make sure that the bottle is still in date and it does not expire till 2/20/28. I'm going to make sure that this medicine matches with the medicine that needs to be administered. This is a TB skin test to make sure that it has the right amount in it, and it does have plenty in it. And it is for a Joanna Doe. The time that I will administer will be at 9 o'clock is the time called for. Okay. And then it shows that I'm going to be giving this in the intradermal area. So then I will be using my intradermal TB needle. So I will cleanse the bottle vigorously with the alcohol prep pad to make sure that it's clean. I will take my needle, and it is 0.1 mils. I'm going to take the cap off and put it into a container. I'm going to draw up 0.1 mils of air. I'm going to put the air in, and then I'm going to draw up 0.1 mils and draw it slowly. To not get any air bubbles in it. And if you can see, that's 0.1 mils. Okay, then I'm going to recap the medications and put it in a bag labeled TB skin test and set it to the side. Then I'm going to get my insulin, NPH, and it needs to be shaken, but not vigorously, to make sure all the powder inside is shaken correctly. Okay. I'm going to look at my order and make sure the patient is ordered NPH insulin, 10 units, and insulin regular, 5 units. It's got the right patient's name on it. This matches right. My insulin regular, it does not expire till 2/2028. And my insulin NPH does not expire until 2/2029. So they're both in date. And I will be giving this in the abdominal area of the patient. So I will get my needle ready. I will clean the tops of the NPH insulin vigorously. And I will get another. And I will clean the top of the insulin regular vigorously. I will draw up the amount of air for the insulin NPH, which is 10 units. Okay, and then I'm going to draw up 5 units for the insulin regular. I will then draw up 5 units of insulin regular. Making sure there's no air. So if you can see that there's 5 units of insulin regular. Okay, so now we're going to go to the insulin NPH. And we have calculated that we need 10 units of insulin NPH, so that's going to make this to be 15 units in the syringe. Okay. If you can see that that is 15 units. Okay. We're gonna show with the stickers. Okay, and I'm going to set that aside for later. Okay, then I'm going to look at my order, and it says that the patient needs Rocephin 500 milligrams. I have Rocephin 500 milligrams per milliliter. It does not expire until October of 2020. It is the correct dose. There's the correct dosage in here. This is going to be administered IM. So I will have my IM syringe. Okay. So I'm going to take the cap off the syringe. I'm going to pull 1 ml of air. And I'm going, nope, hold on, I haven't cleaned it. We're going to recap. We don't have to redo this quite yet. I'm going to clean this bottle vigorously. Okay. Then we're gonna take the cap off. Pull up 1 ml of air. Add it into the bottle. And then we're going to pull up 1 ml without trying to get any air bubbles. You can see that that is a 1 ml. Okay. Then I'm going to recap. And since this is an IM injection, you take the first cap off and you recap it with a new cap before giving the injection. And then we place it into our bag. Then I take off my gloves. Hand hygiene. And then we go to the patient's room. Okay. Hey, my name is Brooke, and I'm going to be your nurse today, and I'm with Belleville State Community College. I have orders to give you some insulin and some antibiotics. Can you give me your name and date of birth? Okay. Jonah Doe, 6/22/55. Okay, let me check your armband. Okay. Everything seems good and your hospital number matches up. Okay, so you are the right patient. So I'm going to be coming in and giving you some shots and stuff. Is that okay if I give you your insulin medication? It is? Okay. Okay, well I'm going to go ahead and get everything ready. So I'm going to hand hygiene. I'm going to put my gloves on. And we're going to put this into your abdomen, okay? Okay. So I'm going to get my insulin syringe ready. Okay, I'm going to look again and make sure that it is the right patient, right drug, and that is the insulin NPH and insulin regular. The right dose, which will be 15 units, 15 units. The right route, which is going to be in the abdominal area. Okay. And the right time. It says to be administered at 8 o'clock, and it is currently 8 o'clock. Okay. So, we're going to get the alcohol prep pad. We're going to clean the area. Okay, I'm going to uncap the medicine. And you can give it at a 90-degree angle. So I'm going to hold the skin tight and stick it. And slowly administer the medication. And I'm going to hold it for 10 seconds. And then pull out. Activate the safety and disregard into the sharps. I will grab a Band-Aid and place a Band-Aid over the area for the patient. Okay. And then the patient is to be administered Rocephin 500 milligrams per milliliter. So I have the shot here. This one is to be administered IM, which we're going to be administering this into the ventrogluteal area. The patient is supposed to take this medication at 9 o'clock, okay? So I'm going to make sure that it's the correct patient. Can you tell me your name and date of birth? Okay, Joanna Doe, 6/22/55. Okay, that matches. And let me look at your armband. Okay, that matches. Okay, and then it's going to be Rocephin 500 milligrams per milliliter. So this is 1 milliliter. So this is the correct medication for the correct patient. And it is 9 o'clock. So it is the correct time to go ahead and administer this medication to this person. Okay. So I'm going to make sure that it is okay with the patient. Is it okay if I give you your Rocephin? It's an antibiotic. Okay. Okay, the patient agrees that I can go ahead and give them the medication. So I'm going to clean the area. I'm going to take the top off the needle. I can give this to the patient at a 90-degree angle. I'm going to hold the skin tight. Make sure that it's the correct area. I'm going to 1, 2, 3 stick. I'm going to pull up. Make sure there's no blood, and there's not. Okay, so then I can go ahead and administer the medication to the patient. Slowly. Okay, I'm going to hold it in there for 10 seconds. Okay, and then I'm going to pull straight up. I'm going to activate the safety and throw it into the sharps container and then apply a Band-Aid onto the area. Okay. Now it is time to do the TB skin test for the patient. Okay. I'm going to make sure I have everything correct. Make sure this is the correct dose, and it's the TB skin test 0.1 mils. TB skin test 0.1 mils. Okay, I'm going to ask the patient for their name and date of birth. It's Jonah Doe, 6/22/55. Okay, I'm going to check your armband. Okay. Is it okay if I administer this TB skin test? Okay, the patient says that it is okay for me to administer. I will take an alcohol pad and I'm going to clean the area. They are being loud. Okay, I'm going to make sure that this is the correct dose, and it is. Going to take the top off, and then with the bevel up, I'm going to administer it in a 5 to 15 degree angle. Okay, must get it over here so you can see. Okay, 1, 2, stick. And then with this hand, I'm going to hold this and see if you can look at that. It's because it's going to form a bleb. Okay, and I'm going to slowly administer the medication. Okay. I'm going to slowly or quickly pull out. Okay, that's good. And then I'm going to discard, put the safety and discard into the box, into the sharps container. Then I'm going to take my gloves off, and I'm going to tell the patient not to scratch, pull, don't put a Band-Aid on the area or anything, and then we're going to have to read the test in 48 hours. So then I'm going to go and start documenting after hand hygiene. Okay, so I'm going to document that the sub-Q on 4/20 of 2020 at 8 o'clock, finger stick blood sugar was 162, insulin NPH 10 units, and insulin regular, 5 units administered sub-Q in right upper quadrant of the abdomen. No bruising noted, bed locked at lowest position with side rails up ×2, call light and reach, and reminded patient to call for assistance to the bathroom. Signed, C. Pridmore, student RN at Bevel State Community College. For the intradermal at 4/20/2020 at 0900, explained purpose for the Mantex skin test. Patient verbalized understanding that the test was necessary to be accepted into the nursing home. 0.1 mil of tuberculin purified protein, lot number 12345, injected ID in right forearm with 1-inch circle drawn around the bleb. No reaction noted 5 minutes after injected. Informed patient to be read on 4/22 of 2020. Instructed patient not to scratch, apply lotion or cream to the site, do not scrub the site or apply bandage over it. Bed locked at lowest position with side rails up ×2, call light and reach, and reminded patient to call for assistance to the bathroom. Signed, C. Pridmore, student RN at Bevel State Community College. For the IM injection at 4/20/2020 at 0910, Rocephin 500 milligrams administered IM in right ventrogluteal site. No complaints of pain, numbness, or tingling. Bed locked at lowest position with side rails up ×2. Call light and reach and remind a patient to call for assistance to the bathroom. Signed, C. Pridmore, Student RN at Bevel State Community College.
That's it.
That's it.